Get over it.
So, and one might guess that it is also the last day of a sitting session. Questions without notice. Senator Keneally.
Thank you, Mr. President. My question is to the Minister representing the Minister for Health, Senator Colbeck. When Western Sydney woman Rola Rad's fever got worse and her fingers and toes became swollen and started to turn blue, she called an ambulance to her home in Auburn. As she arrived at the local hospital, she found out she was positive for COVID-19. With 14 other ambulances already queuing, Rola was sent to a makeshift tent. She was in the ambulance and the tent for a total of 8 hours. Minister, is the New South Wales hospital system coping with the current COVID case levels?
The Minister representing the Minister for Health and Aged Care, Senator Colbeck.
Thank you, Mr. President. Thanks, Senator Keneally, for her question. Mr. President, clearly some elements of the New South Wales health system are suffering stress right now. Clearly, Mr. President.
Order.
But can I say to people in New South Wales and to people in Australia generally that the Australian government has been preparing to support the Australian public health system since the beginning of the pandemic, Mr. President. So we began preparing in February 2020 to support the Australian health system, Mr. President, and we will continue to develop that program. Senator Keneally, I would rather take advice from the New South Wales government, the New South Wales health system, than someone who led the Australian Labor Party to one of the worst electoral defeats in New South Wales history, Mr. President. And so I will take my advice from those people who are running the health system there now and our health officials here, Mr. President. So we have worked, Mr. President, to increase ICU capacity nationally from 2,000 to 7,500 ventilated beds nationwide. We've invested over $30 billion, Mr. President, in COVID health measures, Mr. President, and we continue to work with the New South Wales government, Mr. President, in support of the system. We've invested over $6 billion, Mr. President, in direct COVID support to state hospitals. One of the reasons, Mr. President, we put in place the private hospitals guarantee was to support the public health system to ensure that there was capacity across the country in the case of COVID, Mr. President. And we continue to work with the states cooperatively in respect of ensuring the capacity of the public health system.
Senator Keneally, a supplementary question.
Thank you, Mr. President. Australian Medical Association President Dr. Omar Khorshid warns, and I quote, "To look after the people with COVID, we're going to compromise the care of everybody else. We are confident that we will be able to measure excess death down the track because of the impact of COVID on our broader health system. How many excess non-COVID deaths are expected as a result of higher case numbers?"
Senator Colbeck.
Thank you, Mr. President. And as I've already acknowledged, Mr. President, the COVID-19 global pandemic is having an impact on the health system here in Australia. It did that in Victoria last year, and we invoked the private hospitals guarantee so that private hospitals could support the public health system in Victoria, Mr. President. We will take the measures appropriate in conjunction with the New South Wales government to support the public health system in New South Wales, just as we did in Victoria.
Senator Watt, on a point of order.
Thanks, Mr. President. Conscious of the time there, and we aren't even getting close to an answer to the actual question. How many excess non-COVID deaths are expected as a result of higher case numbers?
Okay, and I take that point. Let you restate the last part of that question. There was a substantial quotation from someone before that talked about the stress on the hospital system. I'll summarise it that way. And I'm listening carefully to the minister, but I think he's addressing that part of the question. But I'll let you remind him of your part of the question, or that part of it. Senator Colbeck.
Thank you, Mr. President. And I again acknowledge that there is stress on the system and that COVID-19 will continue to put stress on the system. But what we're doing, Mr. President, is to work with the states to ensure that there is capacity to support people with COVID, to the extent that the private hospital guarantee ensures over 30,000 hospital beds additionally nationally. The sector's 105,000-strong workforce is available to support the public health system to manage COVID.
A final supplementary question.
Thank you, Mr. President. The Australian Medical Association has today declared, and I quote, "A vaccination rate higher than 80% of the adult population is likely to be required to avoid repeated lockdowns, given the existing constraints on hospital capacity and staffing." Can the Morrison government guarantee that existing constraints on hospital capacity and staffing will be resolved to ensure that Australia can open up safely?
Senator Colbeck.
Thank you, Mr. President. Mr. President, the national plan, based on modelling done by the Doherty Institute, is not just about opening the economy at 70% or at 80%. It is about a careful, safe opening of the economy so that we can ensure that the hospital system doesn't get overwhelmed, Mr. President. That's the well, Senator, if the AMA wants to be modellers, then they should go and be modellers. We worked with the Doherty Institute.
Order.
We worked with the Doherty Institute,
Order.
Mr. President,
On my left.
to do some modelling that
Senator
the basis
Polley.
of which was supporting the health
Order.
system
Senator
and the.
Watt, on a point of order.
Thanks, Mr. President. Again, relevance. This is a really important question about whether the government can guarantee that our hospitals will
Senator
cope.
Watt,
That's
Senator
the
Watt,
question.
Senator Watt, no, there was an extensive quotation again, and by talking about what he is, with respect to what the minister described as the national plan, he is actually being directly relevant to the question. Senator Colbeck.
Senator Watt's ears must be painted on, Mr. President, because I directly addressed the question when I said the Doherty modelling is based on safely, progressively opening the economy to ensure there isn't undue pressure on the hospital system, Mr. President. That's the point of the process, Mr. President. I will go to the AMA for health advice. I'll go to Doherty for modelling advice.
Senator Brockman.
Thank you, Mr. President. My question is to the Minister representing the Deputy Prime Minister, Senator Mackenzie. Can the Minister update the Senate on the implementation of the national plan agreed by National Cabinet, including in relation to regional communities, and how the national plan will enable critical agricultural workers to get to work so farmers can harvest their crops?
The Minister representing the Deputy Prime Minister, Senator Mackenzie.
Well, thank you, Mr. President. Thank you, Senator Brockman, a proud regional Western Australian, very, very keen to support the agriculture community in your home state in particular. Well, our government's committed to supporting our farmers get through the global pandemic, getting the workers and skilled workforce they need to not just get the crop off, milk the cows, shear the sheep and actually continue the global food task, not just here domestically, but to our export markets around the world. This is a $66 billion industry that we want to see continue to grow to $100 billion. And through the global pandemic, we've implemented a raft of measures as a government, providing visa extensions, relaxing the 40 hours a fortnight work limitation for student visa holders. We've established an agricultural workers code with specific states. We've established the Australian agriculture visa, and we've also reopened the Pacific labour mobility programs. But we have to recognise that these measures alone will not provide the workforce that Australian agriculture needs for the task ahead of it. We need to follow the national plan so that lockdowns at a local, domestic, state and international level become a thing of the past. Now, as you know, Senator Brockman, you've got a great grain-growing state over there in WA. And the impact of domestic and international border closures is having a significant impact on your grain growers to get the harvest off that I think is taking place just in the northern wheat belt in over 4 weeks. And then you've got about 6 weeks that if we don't get these workers either from the East Coast states or from internationally, because we do know that there's a global workforce supply chain when it comes to grain harvesting, Canada, Ukraine, right through the US, and then they end up down with us because these are quite specialist roles. I would ask that your Premier actually supports Western Australian grain growers by staffing the Bladen Village facility and allow those workers—
has expired. Senator Brockman, a supplementary question.
Thank you, Mr. President, and thank you, Minister Mackenzie, for that answer. I know how engaged you are with agriculture right across Australia. A supplementary question: how will the National Plan assist not only the agricultural industry but also other essential workforces across regional Australia?
Senator Mackenzie.
Well, as you know, Senator Brockman, through you, Mr President, state and territory chief ministers and premiers have agreed with the Prime Minister to a national plan that will see freedom of movement of people, lockdowns end when it's safe to do so, following the very, very best medical evidence and advice. And it is very, very concerning that there are leaders in this country and chief medical officers perpetuating this myth of zero cases and an elimination strategy is the way out of a global pandemic. Well, I would ask them to pick up a Year 8 science textbook, because that is actually not achievable. And to actually have a plan mapped out using the very best science and health data to make sure that agriculture and regional communities can have the workforces they need to not just grow great, clean, green product, but to actually support the mining industry and the manufacturing industry is a crime, an absolute crime.
Order, Senator Mackenzie. Senator Brockman, final supplementary question.
Mr President. What are the risks Australia faces if the outcomes under the National Plan are not achieved, and how would this impact regional communities and the livelihoods of people who live and work there?
Senator Mackenzie.
Thank you, Mr President. Well, Senator Brockman, you know that we've got a shortage of workers right throughout regional Australia. The job ads go on, and it's not just fruit pickers we need, it is actually sustainable, high-paid careers out in rural and regional Australia. So we need workforce, not just from capital cities, not just from other states, but internationally. And there is only one way out of this global pandemic: to give regional and rural Australia the workforce that they need, the access to global markets that they need to grow and prosper, and that is through the National Plan. States, and your home state, I'm sorry to say, Senator Brockman, has a very, very poor vaccination rate. We have to, as leaders in our country—
Order.
Well, I'll take the interjections. I'll take the interjections from Senator Pratt. $5 billion surplus.
Time
fix your own hospitals.
The answer has expired. Senator Muriel-Smith. Order. Senator Muriel-Smith is asking a question remotely, so I need to be able to hear it.
My question is to the Minister representing the Minister for Health, Senator Colbeck. This week, a major incident alert was issued for 2 South Australian hospitals struggling to cope with pressure on emergency departments, and emergency doctors at the Women's and Children's Hospital warned urgent action was needed before the system fails completely. The SA Salaried Medical Officers Association has said, and I quote, "Can you imagine now if we had COVID in this environment? It's just mind-blowing what we won't be able to do if COVID comes into South Australia." Can the Morrison-Joyce government guarantee that hospitals in South Australia will be properly resourced to cope with the increased demand of going into the next phases of the National Plan with high case numbers?
The Minister representing the Minister for Health, Senator Colbeck.
Thank you, Mr President, and I thank Senator Smith for her question. Mr President, funding contributions from the Commonwealth for public hospitals in all states and territories has grown substantially since we came to government in 2012-13, from $13.3 billion to $25.5 billion in 1920, a growth of, Mr President, 92% growth since we came to government. And as I've indicated earlier today in the chamber, preparation to support the public health system through COVID commenced in February of last year. We have already invested over $6 billion in support to state hospitals for COVID. Over $6 billion, Mr President. We've established telehealth and GP respiratory clinics to ease pressure on hospitals and state workforces. We've created the Private Hospitals Partnership, called the Private Hospitals Viability Guarantee, Mr President, and that provides a 100% contribution from the Commonwealth to support that measure. It provides for the integration of private hospitals with state and territory health systems to ensure over 30,000 additional health beds, and the sector's 105,000-strong skilled workforce is available alongside the public health system to support it in the event of COVID outbreak, Mr President. And we continue to evolve and work on all of the issues that we need to do to support the public health system. And of course, as I've said, the Doherty modelling and the national plan is about mitigating cases and controlling a safe opening to support the health system in the Australian community.
Senator Smith, a supplementary question.
AMA President Dr Omar Khorshid wrote to Mr Morrison warning, and I quote, "If we throw open the doors to COVID, we risk seeing our public hospitals collapse." Is the President of the Australian Medical Association correct?
Senator Colbeck.
Thank you, Mr President. The issue in that statement is if we throw open the doors, and that's not the plan, Mr President. That is not the plan. It's all very well. You need to make up your mind, Senator, whether you support the plan or not, because I tell you on this side there's serious questions as to whether Labor actually support the plan or not. Do Labor support the plan? Do Labor support the plan? You've got the Premier of Queensland who clearly doesn't support the plan. He's more interested in fighting the federal election than supporting Australians through COVID, Mr President. A 3-year-old child can't go and see their mum and dad because of the approach that the Labor Party is taking in Queensland, Mr President. It is outrageous, Mr President. NRL players can go, NRL players and their wives can go. A 3-year-old child can't go to Queensland to see their parents, Mr President. It is completely outrageous what is being proposed. So Labor need to make up their mind, do they support the national plan or not?
Order. Senator Smith, the final supplementary question.
Dr Khorshid has also warned, and I quote, "Too often we hear tragic stories of late-stage cancer diagnosis, emergency treatment delayed and, sadly, avoidable deaths, all resulting from an overworked system. This is only going to get worse with COVID. Can the minister guarantee no Australian will suffer a late-stage cancer diagnosis, emergency treatment delay or avoidable death as a result of increasing demand from COVID?"
Senator Colbeck.
Thank you, Mr President.
Order.
Thank you, Mr President. As I've said a number of times, the process that we're going through is to carefully open the economy using the national plan in the stage process so that we can also protect the public health system, and we've put other measures in place also to support the public health system as that process continues. I've also acknowledged, Mr President, that COVID-19 will place stress on the health system, and that is going to have an effect across the health system. For Labor to pretend that it's not is dishonest. It is dishonest, which is a bit of a trait, Mr President, because they dishonestly pretend that effects may or may not happen if they were in charge, when in fact they would, Mr President. We are dealing with a global pandemic here, Mr President, and there will be effects. Unfortunately, there will be effects. We have a plan to deal with it. Labor have no plan, and we're not sure if they actually support the plan that we have.
Senator, order. It is likely to be Senator Seawood's last question. So, Senator Seawood.
Yes, Mr President, so I'm expecting a really good answer. My question, through you, Mr President, my question is to the Minister for Social Services, Minister Ruston. Hundreds of thousands of people are living below the poverty line through lockdown in New South Wales, Victoria and the ACT. Last year, your government recognised that people on income support needed additional assistance during lockdowns. Most people on income support are not getting additional support during the current lockdowns. Why not?
Minister for Families and Social Services, Senator Ruston.
Thank you very much, Mr President. And can I say, Senator Seawood, it's a tremendous honour to be actually receiving your last question. You have been an extraordinary member of this parliament, and I thank you very much for your question and your continued interest in advocating on behalf of some of our more vulnerable members of the Australian community. Well, Senator Seawood, last year, as you would be aware, when Australia went into lockdown, when the pandemic first hit, we were in a very, very vastly different situation than we currently are. We had no certainty at all around what was about to happen, and the government acted very, very quickly to throw a blanket over the whole of Australia in the hope that we could give Australians confidence to get through what was a very, very dark time for our country. This year we have unfortunately seen a second round of COVID-19 impact parts of our country. So what we have sought to do is to be particularly targeted in our response to people in lockdown areas who have been impacted by a loss of hours as a result of pandemic lockdowns. The first measure was to make sure that anybody who had lost hours was immediately able to have access to the COVID-19 disaster payment that's administered through emergency services through Senator Mackenzie's department. Subsequent to the initial allocation of the COVID-19 disaster payment to people who were working and had lost hours, we also extended it to those people who were on income payments who also had lost work, recognising that those people, we did not want those people to actually be going out and seeking to work because we needed to try and contain the virus in the states that were in lockdown. But in addition to that, we have also maintained support across the whole of the community. But, Senator Seward, as you would know, and having listened to the numerous answers that have been provided in this place by Senator Colbeck, vaccinations are the way we can get our country safe again.
Senator Seward, a supplementary question.
Through you, Mr President. Minister, most people on income support in lockdown are not receiving any additional payments and are living below the poverty line. Do you acknowledge that this puts them at greater risk during the pandemic, particularly if they have to go out to find work because they are living below the poverty line?
Senator Ruston.
Thank you very much, Mr President. Well, of course, Senator Seward, you and I have had many discussions in relation to the payments that are received by Australians who require the support of the Australian welfare system, and constantly in discussion around the issue of the measurement of poverty. What I would say is the Australian welfare system is a very comprehensive and targeted system that seeks to provide support to individuals that reflects their particular circumstances and their particular needs. And that is why we do not just talk about the Australian welfare system as the primary payment that is received by a recipient, but about all of the other things that are provided. Obviously, with families, a tax benefit. Those people that are renting, obviously rental assistance. But we also have a universal system of healthcare and education and many non-cash transfer payments so that we can make sure that our non-contributory, non-time-limited welfare system targets people and the needs of the individual.
Senator Seward, a final supplementary question.
How can you be safe and stay at home if you have to go out to scrape some money together because you are living below the poverty line? Does not the fact that people are living below the poverty line mean they are at greater risk? You didn't answer that the first time. I'll ask it again.
Senator Ruston.
Look, thank you very much, Senator Seward. The government remains absolutely committed to supporting all Australians, whether that be under normal times, under our normal welfare system, or whether that be under the extraordinary times that we find ourselves in at the moment. We recognise that supporting Australians needs to be targeted, as I mentioned to you before. I mean, we will continue to disagree in relation to the definition of poverty and how it applies to Australia's welfare system. But the one thing that we do need to, I would like to reinforce, is that Australia's welfare system is non-contributory. You do not have to have worked and paid into the scheme to be able to get access to it. You do not need it was there for as long as you need. It is not time limited like other schemes around the world. But we also need to make sure that our welfare system, whilst being fair to the people that it needs to support, we also need to be fair to the people who pay for it, the taxpayer. We try and balance those two things to support people but make sure that it's sustainable into the future.
Order. Senator Polley.
Mr President, my question is to the Minister representing the Minister for Health, Senator Colbeck. How many days is it since the Morrison-Joyce government failed to meet its own Easter target for vaccinating, and I emphasise, all aged care workers?
The Minister representing the Minister for Health, Senator Colbeck.
Thank you, Mr President. Senator Polley, through her question, continues the dishonesty of the Labor Party in prosecuting the discussion around this particular matter,
Order.
Mr President.
I have Senator Colbeck. I have Senator Polley on a point of order.
It's relevant. The question was very specific. It was how many days since the Morrison-Joyce government set its
Senator
own
Polley,
target date.
I do take points of order on direct relevance. I called the minister to order, I think, at 12 seconds and 13 seconds. So I'm going to listen to his answer. You've made your point. Yes, Senator Polley?
I just would draw your attention to the word of accusation that I've been dishonest. I thought was unparliamentary, and I draw your attention to it.
The way I heard it, if I could rule, the way I heard it, and if I'm incorrect, I will ask Senator Colbeck to withdraw. He referred to the Labor Party with that term. Well, I didn't hear that. I will rely upon the minister, if he did say it, to withdraw it. If not, I'll check the Hansard, but I was listening quite carefully when I heard the term. If I'm wrong, I apologise in advance. Can I urge senators again, and this happened another time in debate, if we avoid the use of terms, then we avoid getting into unparliamentary language, and if we avoid interjections, we also stay more relevant to questions. Senator Colbeck to continue.
Mr President, and Labor being dishonest not only in their points of order, Mr President, but they are being dishonest in their representation of the issue, Mr President. Mr President, we did set ourselves an objective with respect to vaccination of the aged care workforce, but we received advice from the health professionals that we not vaccinate residents and workforce at the same time, Mr President. I've put that information on the table so many times in this chamber. I know that Labor are living in the past, Mr President. I know that they're only interested in fighting us and not helping us fight the virus. But, Mr President, we received health advice not to vaccinate residents and staff at the same time.
Order.
And we took that advice, Mr President. We then, through the Age PPC and through National Cabinet, set a target date of the 17th of September for all aged care workers to have received a first dose.
Order,
We're
Senator
on track
Watt.
to meet that target, Mr President. We will continue to work to that objective. I had a webinar that was open to every aged care provider and their infection control lead this morning to talk to them about the target and the processes that we're going to, the advice that we could assist them with, and the channels that were available to them to get their workforce vaccinated. This is an important measure, Mr President. We continue to work on it. We are determined to meet our objective, and we continue to work cooperatively with the sector and the unions, I might add, in that course, Mr President. So we continue to work to support people in the aged care sector in Australia.
Senator Polley, a supplementary question.
Thank you, Mr President. Mr Morrison conceded this week that there were still challenges in the aged care vaccine rollout. Was Mr Morrison referring to the approximately 60,000 aged care workers who remain unvaccinated with the September 17th deadline just weeks away?
Senator Colbeck.
Thank you, Mr President. And again, a further example of the Labor Party living in the past. Very, very old data, Mr President. We continue to publish the data, Mr President. It's available on the website. We've actually put on the website every single aged care facility in this country, Mr President. Every single aged care facility in this country, so people can have a look and see what their vaccination rate is. That's transparency, Mr President. That's working with the sector to understand what's going on. And that's why, Mr President, I spent time this morning on a webinar open to every aged care provider in Australia and their infection control lead to work them through any issues they might have in achieving their objective and our objective, Mr President. Their objective. It's not right, Senator. It's not right, Senator. Your numbers are wrong. You're living in the past, Senator. Mr President, and we will continue to work, Mr President, with the sector cooperatively to ensure that we get there.
Order. Senator Colbeck. Senator Polley, a final supplementary question.
Mr President, with approximately 60,000 aged care workers still unvaccinated, will the minister today guarantee that the Morrison-Joyce government will meet the September 17th target?
Senator Colbeck.
Thank you, Mr President. And again, Senator Polley's numbers are wrong, Mr President.
Order.
And as I've indicated a number of times, we are determined to meet our objective, and we know that the aged care sector and the unions, Mr President, are happy to work with us. Well, if that's the answer you want, ask the question, Senator. You can't even get your questions
Order.
right. It's just
Order.
absurd, Mr President, what the Labor Party are tossing up here at the moment.
Order.
Mr President. So we continue to work with Mr President, with the sector to get the workers vaccinated. And as of this morning, 83.4% of the aged care sector have had a first dose. 62% have had a second dose, Mr President.
I have Senator Watt on a point of order.
Mr President, on relevance, the question is very clearly whether the minister will guarantee that the government will meet its target. And while I'm on my feet, I might also ask if you could just review the transcript in relation to the dishonesty point.
I will.
Earlier.
I'm very happy to, and if I'm wrong, as I said, I apologise in advance. Can I say, with respect to the point of order, that was the second part of the question. I can't instruct a minister to use a word or not, but the first part of the question contained an assertion about a number and a statistic that the minister is challenging, and he is entitled to do that and be directly relevant to a question. He's not entitled to stray from the topic, but he is allowed to challenge it. Senator Colbeck.
Well,
order. If we don't have interjections, there's
so,
no
Mr.
need
President,
to respond to
Senator
them. Thank you,
Keneally
Senator
interjects
Colbeck.
that I didn't give any data, and I've just said, Mr. President, that 83.4% of the aged care workforce have had a first vaccination. It's not a number. 62% have had a second dose, Mr. President.
Order. Senator Colbeck. I have Senator Polley on a point of order.
The minister is still avoiding their main question was, are you going to guarantee that those aged care workers, 60,000—
I have repeatedly said that points of order must start with a standing order rather than simply accusing someone of not answering a preferred part of the question in a preferred manner. Senator Colbeck, do you wish to continue?
Thank you, Mr. President. And we will continue to work with the aged care sector with the objective of vaccinating the entire workforce by the 7th of
Colbeck,
September.
time for the answer has expired. Remotely, Senator Roberts.
Thank you, Mr. President. My question is to the Attorney-General, Senator Cash. Senator, my question references independent professional truckies who protested Monday morning in Queensland. Can the Attorney-General inform the Senate of the legal protections afforded Australians under our Constitution, legislation, common law or international conventions that protect the right of everyday Australians to engage in peaceful protest in a public place?
Order. Senator Watt. The Attorney-General, Senator Cash.
Thank you, Mr. President, and I thank Senator Roberts for the question. And Senator Roberts, in relation to the actual legal provisions, I don't have them with me, so I will need to revert to you in relation to that. But in terms of the right to peacefully protest in this country, it is a right that we do hold dearly, and certainly as a society and as a government, it is something that when people do protest, and we've seen protests around Australia, in particular during COVID-19, that they do adhere to the law at all time and certainly respect the rights of others in relation to what they are protesting on.
Senator Roberts, a supplementary question.
Thank you. After the truckies made their excellent point that Senator Hanson and I support, Senator Hanson did ask the truckies to consider allowing horses on trucks in the blockaded traffic to be freed and allowing everyday Australians to go about their day without hindrance. Attorney-General, do you agree that the Australian people would be looking to parliaments to defend civil liberties exercised in a fair manner, not to trash them?
Senator Cash.
Well, again, Senator Roberts, at all times, when people are protesting, and it doesn't matter what the issue is in relation to a protest, they should always protest in accordance with the law. They should respect the laws of the land, and at all times they should respect the rights of others.
Senator Roberts, a final supplementary question.
Thank you. I note that previous protests against COVID measures around our nation were deemed illegal and prosecuted. Yet the Black Lives Matter protests were approved under COVID restrictions. Both series of protests were in violation of similar COVID restrictions. The only difference between those two protests was the subject matter. Attorney General, should politicians be allowed to use public order measures to hide from public criticism?
The minister said they couldn't hear the question because of noise during a remote question. So I'm going to ask Senator Roberts to ask it again, which I know wastes the time of the chamber, but the minister couldn't hear it, so I asked for silence. Senator Roberts, can you repeat your question?
Certainly, Mr President. I note that previous protests against COVID measures around our nation were deemed illegal and prosecuted, yet the Black Lives Matter protests were approved under COVID restrictions. Both series of protests were in violation of similar COVID restrictions. The only difference between these two protests was the subject matter. Attorney General, should politicians be allowed to use public order measures to hide from public criticism?
Senator Cash.
Well, Senator Robert, again, Commonwealth, state and territory governments, the one thing we're all united in is keeping Australians safe during COVID-19. And the Australian government has at all times sought to take measures that combat the virus, but as I said previously, at the same time respecting people's rights and their freedoms. You would also know that states and territories themselves have taken measures under their own laws in respect of COVID-19. And as you have articulated, this is predominantly done under state and territory public health and emergency management legislation. Again, at all times, though, the Commonwealth will work with state and territory governments through the National Cabinet to ensure that Australia's COVID-19 response is one that is measured and is one that is appropriate.
Senator Davey.
Thank you, Mr President. My question is to the Minister for Women's Safety, Senator Ruston. Minister, with the National Summit on Women's Safety starting on Monday and roundtables starting today, can you explain how the summit will support our government's goal to reduce violence against women and children?
Minister for Women's Safety, Senator Ruston.
Thank you very much, Mr President, and I thank Senator Davey for her question. Well, the National Summit on Women's Safety is an absolute critical step in the development of the next national plan, not just to reduce violence against women and their children, but to end it once and for all. And the plan must be an ambitious blueprint to wipe out the scourge that is domestic violence on our national landscape. The first plan began in 2010, and since then we've developed a much larger body of evidence and a better understanding about the ways domestic violence is perpetrated. Our understanding of violence against women has changed since the first plan came into effect, and that's what we seek to understand through these roundtables. We know that domestic, family and sexual violence is pervasive and it takes many different forms. Today and tomorrow the roundtables will consider all of those different forms of violence, things such as coercive control, technology-facilitated abuse and the impact of violence that it has in the home on children. Participants in the roundtables include survivors, frontline service workers and people who deal with domestic, family and sexual violence every single day in their line of work. So, together with the Minister for Women, a number of my colleagues, members in this place, members in the other place, from all parties in this parliament, have been observing these roundtables so that we can hear directly, firsthand, from people, often survivors of these different types of domestic, family and sexual violence, so that we can make sure, as we develop the next national plan to end violence against women and their children, that we have got the voices of people who have survived this abuse firmly embedded into our decision-making. But importantly, the summit also gives the opportunity for all Australians to have their say and to be involved by the live streaming, because we want to have a public debate to end this scourge on our society.
Senator Davey, a supplementary question.
And Minister, you spoke about the next national plan to end violence against women and their children. Can you please explain to us how this next national plan will consider the needs of our diverse community in Australia?
Senator Ruston.
Thank you very much, Mr President. Well, family, domestic and sexual violence is a scourge that's across the entire Australian landscape. And we know that it doesn't matter where you live, how old you are, where you've come from, whether you're a first Australian or a new Australian, your socio-economic status, you can be affected by family, domestic and sexual violence. We also recognise that some women are more likely to experience violence than others, and some have greater barriers to accessing critical support services. This morning we began a series of roundtables that will form part of that consultation, hearing this morning from representatives from the LGBTIQIA+ community, as well as Aboriginal and Torres Strait Islander communities. We also had a roundtable to interact on issues around perpetrators and making sure that we've got early intervention programs so that we can get in early and stop the violence. The discussion's well underway, and I'd really like to acknowledge the huge number of people that are participating in their roundtables, some of them under very traumatic situations.
Davey, a final supplementary question.
Thank you, Minister. And how will the National Summit on Women's Safety address this really important issue of sexual violence?
Senator Ruston.
Thank you very much, Mr President. Well, we have included sexual violence in the plan this time for the first time because we absolutely believe and are committed to reducing sexual violence and harassment in Australia to ensure women and girls of all ages can be safe at work, safe at home, safe when they're studying, safe when they're online. And preventing and responding to sexual violence will be a key discussion at the National Summit, with expert panellists including this year's Australian of the Year, Grace Tame, Women's Safety New South Wales CEO Hayley Foster and the University of New South Wales Associate Professor Dr Michael Salter. The panel will inform the plan and ensure sexual violence is absolutely at the forefront of ending violence against women once and for all. This work builds on the $29 million to develop new primary prevention initiatives to address sexual violence, which will now allow targeting resources to campuses of universities and build on our very successful Stop It at the Start campaign.
Senator Hanson-Young.
Thank you, Mr President. My question is to the Minister representing the Environment Minister. It has been revealed under FOI today that the Morrison government directed independent science agency AIMS to release a report into the health of the Great Barrier Reef before the report was complete. This, of course, was to be used for political lobbying ahead of the UNESCO vote on the danger of the reef. Will the minister tell the parliament who gave the direction for this early release? Was it the Environment Minister or her office, or did the direction come from the top and it was the Prime Minister and his office that was interfering with the scientific report?
Minister representing the Minister for the Environment, Senator Hume.
Thank you, Mr President, and thank you, Senator Hanson-Young, for your question, and I apologise for getting your name incorrect earlier. But can I just scratch my head and say, first of all, that I'm not entirely sure what the outrage is about, because it seems that the Greens and the ABC are in quite a lather, not because the report was withheld, not because it was altered, but because it was in fact released. This is bewildering. So we released it, and we released it a week after its key findings were already published in an op-ed by AIMS themselves. So hold the front page on that one. The Minister for the Environment welcomes that report from the Australian Institute of Marine Science that shows that after a series of severe and widespread disturbances over the last decade, coral cover has actually increased across all regions. Now, these results are an outstanding demonstration of how the reef can actually recover following disturbances if given enough time to make that recovery. These reports have been released annually since 2016, so they should come as no surprise. In 2016, after that mass bleaching event, and they are the most comprehensive record of reef condition that's available for the Great Barrier Reef. Now, as much as these results are good news in the short term, they don't change the need for our ongoing, highly regarded reef management and strong global action on climate change to improve the outlook of the reef in the long term. So this program is part of the Australian government's $3 billion commitment to protecting the reef and support the work of reef communities, reef managers and marine scientists, traditional owners and, of course, the thousands of Australians who depend on the reef economy. Australia is world-leading in our coral reef science and management, and we readily share our findings and our expertise at a global level.
Senator Hanson-Young, a supplementary question.
Thank you, Mr President. Isn't it true, Minister, that the reason the Environment Minister was so desperate to get this report out before it was finished and spent so much time and money lobbying the UN members was because the government was desperate to cover up how poorly you have taken climate action. You are embarrassed about your poor performance.
Order. Senator Hanson-Young.
Well, I can't hear over Senator Seselja, even though he's got a mask on.
Senator Hanson-Young, have you concluded your question?
I've concluded my question.
Senator Hume.
Well, thank you very much, Mr President, and I reject both the premise of Senator Hanson-Young's question and the undergraduate tone with which it was directed. Did the government direct an independent science agency to release a report early? Is that seriously what you are suggesting? The AIMS Chief Executive, Paul Hardesty himself, has already made it clear that any suggestion that this report was rushed is entirely incorrect. The technical report was already finished. The document only needed to be prepared for publication, which required it to be formatted and laid out for publication. But the key findings of that report had already been finalised and, in fact, published and publicised in an op-ed by the CEO of AIMS on the 12th of July. That was before the government requested the report's release to provide to the World Heritage Committee. I am afraid, Senator Hanson-Young, you are poorly mistaken.
Senator Hanson-Young, a final supplementary question.
Thank you, Mr President. UN head Antonio Guterres has declared the IPCC report a code red for climate, and he's urged countries to do more to reduce both carbon pollution and protect biodiversity in the fight against the climate collapse. When will this government take seriously the emergency we're facing of the collapse of the climate and the biodiversity crisis? When will you have proper targets for 2030 ahead of the end-of-year COP
Senator
conference?
Hanson-Young. Senator Hume. Order. Senator Hume.
Thank you very much, Mr President. And I want to reiterate the fact that the Morrison government is deeply committed to protecting the World Heritage Great Barrier Reef, and we make no apologies for that, or for defending our reputation as the best marine park managers in the world. We are benchmarked against global standards, and Australia's management of the reef is recognised as a leading example and is considered by many to be the gold standard for large-scale marine protected area management, according to a UNESCO report. And that fact is in fact acknowledged by many, including the World Heritage Centre itself. In its draft decision on the reef presented to this year's World Heritage Committee meeting, it said that the state party, referring to Australia, it commended the state party, Australia, for the strong and continued efforts to create the conditions for the implementation of the Reef 2050 long-term sustainability plan, and that included through unprecedented financial commitments. This is the centrepiece of Australia's reef protection efforts, this 2050 plan jointly developed by the Queensland Government.
Thank you very much, Mr President. My question is to the Minister representing the Minister for Health, Senator Colbeck. As a result of vaccine supply shortages, the New South Wales government has been forced to extend the gap between the first and second doses of Pfizer vaccines to 8 weeks. What impact will this change resulting from a shortage of vaccine supplies have on the timeframe of reaching the 70% and 80% targets? And did the New South Wales government advise the Morrison-Joyce government of this change before it was announced?
The Minister representing the Minister for Health and Aged Care, Senator Colbeck.
Thank you, Mr President. Can I say I reject the premise of the question that there is a vaccine shortage. Mr President, there are significant volumes of vaccines available to Australians. In fact, if someone wants to go out and get— They say they support the vaccine rollout program. They say that they support both vaccines, but the scoffing from across the chamber belies that, Mr President, and they're only focused on Pfizer, and they're not concerned about AstraZeneca, which has done a large proportion of the work, Mr President, in the system, Mr President, and noting that they've actually shortened the time frame for doses of the AstraZeneca vaccine, Mr President, to promote the vaccine rollout, Mr President. And we've supported New South Wales in respect of their vaccine rollout by putting 50% of the additional vaccines that we got from Poland, 500,000+ doses, into New South Wales to support the rollout. We distributed the rest of that across the vaccine rollout to the states on a per capita basis, Mr President. So we have and we will continue to support states in respect of the vaccination program, Mr President. And today, Mr President, we have passed 20 million doses. A significant effort, Mr President. The Labor Party should be celebrating that, Mr President.
Senator Colbeck. Senator Watt on a point of order.
Thanks, Mr President. Again on relevance, we would like this minister to answer questions such as what impact the change the government—
there's no such as, Senator Watt.
Well, specifically the question is what impact the change announced by the New South Wales government will have on 70–80%.
That was one of the questions. Sorry, Senator Cash.
Thank you. And on the point of order in relation to relevance, the minister was directly relevant. The first response he made was, "I reject the premise of the question."
Firstly, Senator Watt, order. Senator Watt, if I could rule. That was one question amongst several asked. To address, there were with a preface, and a minister cannot simply reject the premise of a question and say everything they want. They still must remain directly relevant to the material in the question. I'm listening carefully to the minister. As I heard him, he was talking about vaccine supply. It's not a place for a general address on the vaccine rollout program, but if he's talking about matters raised in the question, I believe he's directly relevant. I can't instruct him how to answer it. Senator Colbeck.
Thank you, Mr President. And we will continue to support New South Wales and other states with respect to the vaccine rollout. Mr President, in fact, to date, as I've indicated, 20,028,084 doses of vaccine across the country have been administered, Mr President. And, of course, both vaccines, not just Pfizer, Mr President, both vaccines are playing an important part in the rollout. So, yes, Mr President, there are different time periods in different states between doses. Victoria has extended their doses out to 6 weeks rather than 3 weeks for Pfizer.
Order, Senator Colbeck. Senator O'Neill, a supplementary question.
Thank you very much, Mr President. Will the New South Wales government's decision to extend the gap for Pfizer vaccines from 3 weeks to 8 weeks force those who've already booked their appointments to wait longer?
Senator Colbeck.
Thank you, Mr President. If someone has a booking for a vaccination, Mr President, I would urge them to keep it. And I would urge anyone who wants to take up a vaccine, Mr President, to make a booking to take up a vaccination, Mr President. There is ample supply of AstraZeneca available right now. Right now, in fact, Mr President.
Order. Senator, I had Senator O'Neill on her feet first. Senator O'Neill on a point of order.
Yes, and it's with regard to relevance. The question was pretty straight and it did not refer to AstraZeneca. It's a particular question about the rollout of Pfizer, the 3 to 8 week delay, and I urge you to bring the minister actually to the question in hand.
It was a relatively specific question. Was the word Pfizer mentioned in the question? In the supplementary? Okay, my notes, sorry, I didn't have that. I try and scribble as quickly as I can. This is a specific question. I'm going to ask the minister to specifically address the issues in the question, but again, I cannot instruct the minister the terms in which to answer a question, the terminology to be used, or the content of the answer. So this question goes to the extension, in my view, of the time period for the vaccine. I take it I didn't have Pfizer, but I take your word for it, Senator O'Neill. And it goes to whether or not people will have to wait longer, or whether or any other arrangements relative to both of those that are directly relevant. Senator Cash, are you seeking the call?
Thank you. And on the point of order in relation to relevance, Mr President, you are right. The question was in relation to the New South Wales government's decision to extend bookings in relation to Pfizer, and will people have to wait longer for a vaccination? The minister is directly referring to whether or not people have to wait longer.
Senator Keneally, we're not going to get into whether there are two words in it, because I heard the interjection there. I'll take your submission.
Thank you, Mr. President. I do appreciate that. The question was actually, would it force those who've already booked their appointments to wait longer? It didn't go to whether people should book or not book. It went to directly the question of people who've already got appointments booked for Pfizer.
I appreciate it did not go to. It's not the place for a general discussion of whether someone should book for a vaccine. But at the same time, a tightly worded question, an answer can still be directly relevant by addressing the issues raised in the question, even if it is not addressed in the terms the opposition would like. That is what the motions to take note are for afterwards. So I call Senator Colbeck, taking all that into account, to continue.
Thank you, Mr. President. As I said, I would urge anyone who's got a vaccine appointment to keep that appointment. Anyone who doesn't have one to make one, Mr. President. The Labor Party want to make this all about Pfizer, but the vaccine rollout is not just about Pfizer, Mr. President. There are 2 vaccines currently in our vaccination program, and Mr. President, and there are ample supplies of AstraZeneca available right now. To date, Mr. President, we have received 32.7 million doses of vaccine, 14.5 million doses of Pfizer, Mr. President.
Senator Keneally, on a point of order.
Relevance. This is nowhere near the question that Labor has asked.
Well,
I ask you to bring the minister back to the question.
I do not think that to be directly relevant to an answer, a brand or manufactured version of a vaccine is going to meet. I can apply that as a strict test. If the minister is directly addressing the issues in the question, there is an opportunity to take note. On my right, I think order. I think, with respect, the submission that I instruct the minister to speak about one brand of vaccine is actually going beyond direct relevance and actually seeking me to direct him how to answer a question. Senator Keneally?
And thank you, Mr. President. I appreciate the point you're making, but this goes to a decision in the New South Wales government that is directly relevant to just one brand of the vaccine. We didn't have an option to ask about other brands. The New South Wales government made this decision.
And there's a chance to debate the merits of an answer.
And it is a simple question. If people will have to wait.
No. There is an opportunity to debate the merits of how a minister answers a question. Direct relevance does not go to using the very words raised in a question, or in this case, the brand. You have an opportunity to debate that afterwards. Senator Colbeck.
Thank you, Mr. President. And the Labor Party directly contribute to vaccine hesitancy by their dismissal of AstraZeneca, Mr. President. We have 2 vaccines in our vaccination program.
Order, Senator Colbeck. Time for the answer has expired. Order, Senator Colbeck. Senator O'Neill, a final supplementary question.
Thank you, Mr. President, and I'm sure it'll disappoint New South Wales men and women who couldn't get Pfizer, that answer. It's just terrible. Despite the 107 tragic deaths in the current Delta outbreak, 957 people in hospital and 160 in the ICU, the Morrison-Joyce government is forcing people in New South Wales to wait an additional 5 weeks to be fully protected from COVID. Does the Morrison-Joyce government take responsibility for failing vaccine supply, or does Mr Morrison maintain that ultimately everything's a state matter?
Senator Colbeck.
Thank you, Mr. President. And despite all their protestations, Mr. President, clearly the Labor Party continue to attempt to undermine the confidence of the Australian community in vaccines, particularly AstraZeneca, and it's not the first time Senator O'Neill has done that this week with her scoffing across the chamber with the mention of AstraZeneca.
Senator Colbeck, I have Senator O'Neill on a point of order. Senator O'Neill.
To assist the minister, I just want him to know that I got AstraZeneca. I do support the rollout, but I want Pfizer for people who need it.
Senator Colbeck.
Thank you, Mr. President. There are 32.7 million doses of vaccine that have been made available in the Australian community since the beginning of the vaccine rollout, 14.5 million doses of Pfizer, 18.2 million doses of AstraZeneca. I thank every one of the people who have taken up the 20 million doses that have currently been put into arms. I urge every Australian to take up the opportunity to take a vaccine of whatever variety is available to them, Mr. President, because that is what is going to make us safe against the COVID-19 virus.
Senator Scarr.
Bring us home. Thank you, Mr President. My question is to Australia's passionate Minister for Sport, Senator Colbeck. Can the minister update the Senate on the wonderful achievements of our Australian para-athletes at the Tokyo Paralympics?
The Minister for Sport, Senator Colbeck.
Thank you, Mr President, and I thank Senator Scarr for his question. Australia, Mr President, sent a team of 179 athletes and 168 support staff to the Tokyo Paralympics. They have represented our nation with distinction, as we've seen with pride, and their performances on the world's greatest stage have brought immense joy to many Australians over recent weeks in what's been a very challenging time. Mr President, Australia's para-athletes put in significant effort in preparing for the Olympics, just like their Olympic counterparts. The Commonwealth Government is currently the major funding source for Paralympic sports. In the 5 years leading to the Tokyo Paralympics, the government has provided $88.8 million for para-athlete high-performance programs. The government recognises, however, that there is a disparity in these in payments available to Australian medal-winning athletes compared in the Paralympics compared to the medal-winning athletes in the Olympic Games. Medal incentives are currently paid by the Australian Olympic Committee to Olympic medal-winning athletes. The governing body of Parasports Australia, Paralympics Australia, does not have the financial capacity to do the same for Paralympic medal-winning athletes, Mr President. And that is why I am absolutely delighted to advise the chamber that the government has decided to make available funding to Paralympics Australia, which would allow it to make payments to medal-winning athletes at the Tokyo Paralympics equivalent to the payments, Mr President, made by the AOC to medal-winning athletes at the Tokyo Olympics.
Senator Scarr, a supplementary question.
Thank you, Mr President. How have Australians reacted to the performances of our para-athletes in Tokyo, including in relation to the wonderful Queenslander Grant Scooter Patterson, who after winning a medal said, and I quote, "I'm living proof that if you follow your dreams long enough, they might come true"?
Senator Colbeck.
Thank you, Mr President. Senator Scarr, there have been some absolutely wonderful stories out of the Paralympics, and I'm sure over the coming days there'll be many more to come. Australia's medal tally to date is 13 gold, 23 silver and 24 bronze, a total of 60 medals thus far, and I'm sure there'll be more over the next few days. Importantly, our team has competed with the pride that you've expressed and represented our nation with so much pride and capacity. Chef de mission Kate McLaughlin put it perfectly when she said earlier this week, the culture of the Australian Paralympic team is shining through at a time when it's been severely tested. I couldn't be prouder of the way that everyone has risen to the occasion. Mr President, can I echo her comments? And I'm sure the rest of Australia would do exactly the same.
Senator Scarr, final supplementary question.
Thank you, Mr President. How is the Liberal National Government assisting our para-athletes to achieve their goals, including as we look ahead to the 2032 Games in my home state of Queensland?
Senator Colbeck.
Thank you, Mr President. I'm excited to say that Australians are taking to the Paralympics like never before. Host broadcasters Channel 7's comprehensive coverage has been met with absolutely record ratings. The coverage has reached 2.39 million viewers a day nationally, which is quite extraordinary. And to hear the goalball girls say that they were proud to see their sport on free-to-air television is saying something. Can I thank Channel 7 for its ongoing commitment to the Paralympics? In terms of social media, Australians have also engaged with our para-athletes like never before. Paralympics Australia has reported record levels of social media engagement and presented some truly inspiring stories about our para-athletes. Their journey to Tokyo, Mr President, their journey beyond and their journey towards Brisbane 2032.
Senator Cash.
Mr President, I now ask that further questions be placed on notice.
Thank you.